Okay, so I verified my doctor's orders, and we're going to go ahead and place an NG tube into Miss Jones. So I've gathered all my supplies, and I'm going to go ahead and go into the room. Knock, knock, knock. Good morning, Miss Jones. How are you feeling today?
I'm doing good.
Okay. The doctor wants to go ahead and place an NG tube. Are you aware of this?
Yes.
And are you in any pain?
No, not right now.
Okay. So can I go ahead and get your first and last name?
Susie Q. Jones,
Okay, and date of birth?
2374.
Okay, and has the doctor explained this procedure to you?
Yes.
Okay, so what we're going to do is we're going to go ahead and run the nasogastric tube through your nostril into your stomach. And can you go ahead and place a finger here and go ahead and blow out one nostril at each time so we can assess and see which nostril would be the best to place the tube? Okay, good. Okay, so it looks like you're clear on the left side, so we'll go ahead and place the NG tube on the left side. Does that sound about right to you?
Yeah, that'll be fine.
Okay, perfect. So I am going to need your help during this procedure. Let's go ahead and look at this. Okay, I'm going to go ahead and raise the bed to a good working height for me and to 90 degrees so the patient's sitting up. Good. Okay, here you go. So, go ahead and get my tape ready here. Okay. So, if you can go ahead and hold this water. Okay, so what we're going to do first, we're going to start measuring here from your ear to your nose and from the tip of your nose to your xiphoid process to see how far down we need to place the tube. We'll mark that with a marker. So we've got that ready. Then we're going to go ahead and lubricate the first 4 inches of the tube. So if at any time that you feel that you cannot handle this procedure or you can't tolerate the procedure, go ahead and raise your right arm, and we'll go ahead and stop at that time, Ms. Jones, and then after a moment we'll go ahead and continue and try to see if you can tolerate the procedure. Is that okay for you?
Sure.
Okay, so let's go ahead and start. Okay, so we're going to place her head in the sniffing position, and okay, so we go ahead and put the tube in until we meet resistance and hit the gag reflex. Okay, and so at this point she's ready to go ahead and tilt her head forward. And Ms. Jones, if you can go ahead and take sips of the water for me and swallow at the same time so that we can go ahead and advance the tube into the correct placement. Okay. Perfect. Okay. Okay, so we've reached our mark, and it looks like it is in the right space. So at this point, we're going to go ahead and aspirate, see if we have the correct placement, if the pH is between 0 and 4. So we want to make sure that the cock stop is off to suction at this point. And we'll put the syringe in and aspirate. Okay. And it looks like it's between 0 and 4. So we can actually go ahead and place the gastric juices back in. then we go ahead and turn this off. We're going to secure the tube to the nostril. Then we'd secure the tube to the gown and make sure that the piggyback is up. And we'll go ahead and turn it on to suction as we get the suction tube here. Okay. And we could secure this to the gown with tape. Okay. And make sure the blue tube's always above the stomach level. And go ahead and take the supplies away. And we can clean up the supplies. And then provide oral care for Miss Jones. Okay. We're going to go ahead at this time and lower the bed. Miss Jones, is there anything else I can get you at this time?
No, I'm good.
You're comfortable?
Yes.
Okay, so here's your call bell. If you need anything, please go ahead and give me a call. So at this time, I would go ahead and throw my supplies or my things away that I used, and take off my gloves, wash my hands, and then I would document on the proper screens regarding the nasogastric tube insertion, and I would go ahead and obtain an x-ray for tube placement to make sure that the tube is in the correct position.